Thank you, Chair. We're live on YouTube, so I'll hand over to you. You're on mute, Chair.
I wasn't. Oh, all right, thank you. Good morning and welcome to this virtual meeting of the Poverty Working Panel on Monday, 22nd of November 2021. I'm your chair, Councillor Megan Armstrong. I would also like to welcome anyone watching this meeting via the live stream. At this point, I'd also like to welcome Sarah Hellman, who is one of our new Democratic Services team members. So welcome, Sarah, and nice to meet you. Based on the decision of our extraordinary meeting of Council on 26th of July, I would like to remind both members and public attending or watching that this Council has delegated much of its decision-making power to our senior officers. This is for a short period of time only, to the 17th of January 2022, and is due to concerns relating to COVID risk. Consequently, this meeting is being held remotely and on a consultative basis only. We will continue to adhere as closely as possible to the procedural rules detailed in our Constitution. However, where this meeting would have normally decided a matter, it will now make recommendation to a senior officer. The officer will then take that recommendation into account when making their decision. The meeting can be viewed live online and will be recorded. Please bear this in mind throughout the meeting. Therefore, may I remind colleagues to be careful with their language and that the Code of Conduct applies throughout our meeting. We reserve the right to remove and disconnect any participant disrupting the meeting by whatever means. As this meeting is dependent on internet connection and the power supply, in the event of a break in the internet connection or a power cut, please bear with us as we try to reconnect. If we are not able to reconnect after 15 minutes, this meeting will be adjourned and reconvened at a later date. Please check the committee page on our website for further details. Could colleagues please ensure your microphone is muted when you are not speaking? This will help avoid any disturbance from background noise. Could you also keep your points short and not interrupt when someone else is speaking? Should you wish to comment, please raise your electronic hand and wait to be called. All councillors have been sent the agenda for today's meeting, and it can also be viewed on the website at www.eastdevon.gov.uk. We'll now start the meeting by doing a roll call of the members of the working panel. Can you please now unmute your microphone, and when you hear your name, please confirm by saying present. When you have confirmed you're present, please mute your microphone again. Thank you. Sarah, if you'd like to read out the names, thank you.
Thank you, Chair. Councillor Allen.
Yes, I'm here, Sarah.
Thank you. Councillor Armstrong.
Present.
Councillor Chapman.
Present, Sarah.
Thank you. Councillor Desaram.
Present, thank you, Sarah.
Thank you. Councillor Jarvis.
Present, thank you, Sarah.
Thank you. Councillor Whibley. No. And Councillor Woodward.
Present, thank you.
Thank you, Chair.
Thank you, Sarah. I can confirm we are quorate today. So agenda item 1, public speaking. Have any members of the public been registered to speak, Sarah, at today's meeting?
No, they haven't. Thank you, Chair.
No, okay. Item 2, apologies. Apologies have been received from
Councillor Hawkins and Councillor Rickson, panel members, and non-panel member Councillor Hall.
Okay, thank you, Sarah. Thank you. Item 3, declarations of interest. Declarations of interest will be noted by raising your electronic hand. Please state your declaration, including which agenda item your declaration relates to, if it is a personal or a prejudicial declaration, and state what exactly the interest is, please. I can't see any hands raised. Sarah?
No, I can't. Thank you,
I don't
Chair.
think there are any. Thank you. Item 4, minutes of the previous meeting held on the 20th of September 2021 on pages 3 to 8. The draft minutes of the previous meeting held on the 20th of September 21 have been circulated. If any members have comments on the minutes, please raise your electronic hand. If there are no electronic hands raised, I will take it that you are happy to receive and accept the minutes. No hands raised. Are we all happy?
Yep, no
Thank you.
hands raised.
Thank you very much. Item 5, voluntary community and social enterprise, Vcse sector consultation. We have Jamie Buckley joining us today. Jamie, with a report from her on this consultation. Jamie is the Community Engagement and Funding Officer for East Devon. So thank you, Jamie. If you'd like to give your presentation, thank you very much.
Thank you, Chair. Included in your agenda pack is the results of a questionnaire that we sent out to the voluntary community sector within East Devon. But if I just run through the background to that, at the moment there is no council for voluntary service within East Devon. We're the only district where there isn't one. There did used to be one provided by Action East Devon, but they withdrew that in favour of providing more service delivery projects. So we currently have no council for voluntary service, and this became more apparent that it was a problem during coronavirus, because within pretty much every other district in Devon, the CVS, Council for Voluntary Service, led the charge, really, led the support for the local community, mobilised all their voluntary and community sector organisations, and facilitated support to residents. But within East Devon, we didn't have that. So East Devon District Council stepped in a little bit. There were a lot of very motivated voluntary and community groups who sort of set up their own support systems, but it would have been so much more helpful to have a CVS. Devon County Council ended up supporting West Bank, an organisation based in Budleigh Salterton, to provide some level of CVS support in terms of data protection and safeguarding advice for groups that were supporting their communities through coronavirus, but that's now ended. So we're sort of left with a gap again, really, for CVS support in East Devon. Throughout coronavirus, Chair, as you know, we conducted quite a lot of community coronavirus support groups. I think it was once a month we were meeting with various people such as Honiton Coronavirus Support, the coronavirus support people from Cranbrook. So we all got together and we had Zoom meetings to make them feel a bit less alone, really, and to see if we could help them in any way, and if indeed they could help each other in any way. So that sort of also garnered support for this voluntary and community sector support, because they were saying, oh, we need this, we need that, and there's a bit of a vacuum. So we gathered together some thoughts. John produced an interim report stating what we could potentially do, but obviously this would be subject to consultation and further development with the voluntary and community sector, because they know what they want, they know what they need. So from that, we sent out a consultation, which was publicised through various press releases on social media, basically saying this is our draft proposal, really, in terms of providing some kind of council for voluntary service level support in East Devon to all of our community and voluntary sector. What do you think? Do you think that anything needs adding? Do you think that we've put anything in there that shouldn't be in there? And 28 groups responded to that, which is somewhat below what we'd hoped for. But part of the issue is, obviously, without that overarching support and without that list, that reliable, up-to-date list of voluntary and community groups and social enterprises, we don't have any way to contact them, really, which is something that some kind of CVS support could provide. So we did the results for that. They were very supportive of our proposals and suggested some changes and some additions, as outlined in the agenda report. And now we're at the stage where really I wanted to discuss it with this panel. How might we progress this proposal? What do you think about this proposal and the report? Obviously, we need to provide it some kind of commissioning brief if we want to get ideas in from the voluntary and community sector. We have had several expressions of interest from local groups and local people saying that they would be interested potentially in providing this kind of support, depending on what it would be and what it would look like. So yeah, it's a bit of a discussion. I was interested to discuss with this panel really how we might progress this proposal. Where might the money come from for this? Because obviously there's not money available at the moment. Looked into grant funding. Would it be something that council would wish to support in terms of a monetary contribution? So yeah, just a bit of a discussion with this group would be really helpful. I think, John, do you have anything to add to what I've just said?
Thanks, Jamie, and credit to you as well for producing the discussion document and doing all the analysis. I suppose one thing that's worth saying is that we held our communities working together seminar last week that Megan chaired, and I get a real sense that our community and voluntary groups, despite not having a kind of coordinating group, are really strong, and we heard some fabulous examples of how the groups have been supporting communities over the last few years. And really, I think if we've got a CVS type organisation in place, we'll only strengthen what is already a huge and magnificent effort. And those groups seem to be pretty content, was my reading of the meeting. We kind of tested some of the ideas. We tested the poverty strategy with them, and again they were very supportive, and I came away with a pretty warm feeling about our groups. Having said that, we can do more, we can do better, and this might be the way that we can support them with some of the kind of administration, funding security, legal complex sort of issues that's a distraction for many of the community and voluntary groups. So we can help them focus on what they do best, which is the direct support. So that's the kind of thinking behind the discussion paper, recognising there's not one size fits all. We didn't want to impose our thoughts on our quite diverse range of groups, and the feedback has been quite reassuring in many ways, in so much as we seem to be thinking on the same wavelength. Thanks, Chair.
Thank you very much, John. Before I open up to questions, Jamie, was there anything else you wanted to add to what you said, or any comments from what John said?
Yeah, some of the things that were mentioned in the Working Together event last week, where they would love some support in terms of the legal issues around data protection and safeguarding. And yeah, as John was saying, that sort of detracts their time and focus away from doing what they're best at and what they're absolutely amazing at, which is providing that support directly to residents and directly to their local communities. So yeah, just to completely agree with what John said. I mean, in terms of what happened at the Working Together event, we had the presentation from Honiton Coronavirus Community Support, and I was completely blown away at the time with what happened there and how quickly it happened. Within 4 days, they'd practically mobilised the whole community sector within Honiton and provided a totally amazing level of support to their local residents that I would never have dreamed would happen that quickly. So yeah, they are completely amazing, and anything we can do to support them, I think, would be quite well received and be quite fruitful, really.
Okay, thank you, Jamie. Are you happy for us to take some questions now? Is that all right? Before you do that, I just wanted to comment on what John and Jamie have said. I think what Jamie and I have noticed over the last 12 months, whilst we've been having these COVID support group meetings, is that the things that really concern community groups, and we may be able to help in a little way with this, is the ongoing funding. That's a long historic thing. It will go on forever and ever and ever, I expect. You know, I've gone through this many years ago with running charities and voluntary organisations, and a lot of it is about not just the funding for what they're doing, but it's the funding for the core of the business that is really difficult to get. Funding for new projects is relatively simple, relatively easy. It's not easy, but it's relatively easy. But it's the core funding, it's the basic funding that they need to hold everything together, to pay for the office space, to pay for the phone, to pay for all the basic stuff that you need. And the other thing that's come up strongly in those COVID support group meetings is about the training for volunteers. I'm looking at Jamie and hoping that she'll agree with what I'm saying. Just tell me if you don't. But the training for volunteers and for staff ongoing, and it's that kind of, that's basically running the core business as well, making sure that your volunteers are supported, that you're recruiting properly, that you're giving them the training that they need. So all of that, it's just the ongoing background work. That's what I would call it. It's not the frontline stuff so much, because as John and Jamie have said, that's often done really well. But it's that background stuff that we may be able to help with. So sorry about that. I banged on a bit there, but I thought I'd just say that that's the take that I've had from the groups in the last 12 months and from last week's Working Together event as well. So I see we've got some, I'd like to take questions if we could, and comments from people who are not on the panel. So I'm not sure if I've got these in order, Sarah and Sarah. I think Councillor Miller, is he?
Yes, Councillor Miller, yes.
Yeah, okay, thank you, Paul.
Thanks, Chair. Yeah, I've gotten to know quite a number of these voluntary organisations in Exmouth, really from the beginning of the pandemic. And one of the key issues I identified, doing a little bit of volunteer work for one of them, was firstly that not all of the voluntary organisations offering support to relieve poverty were coordinated, which is why I think this Council for Voluntary Service firstly would be very beneficial. But also, as clearly you and other officers have identified, I remember feeling really uncomfortable with, I won't mention the voluntary organisation that I did a bit of volunteering for, because they do a fantastic job on the front line, but there was clearly some serious data protection and safeguarding issues that could have taken place, because there just wasn't that expertise and advice coming through. So I think from my perspective, looking at the report and listening to Jamie's report, it would be a fantastic idea to set this thing up. One issue that's been raised, I see, by Jamie, was this would cost money in terms of this would affect the council's budget. So one question for me would be what kind of figures are we looking at in terms of how much would it cost to set up, and how much would it cost to run? Would we have to recruit new officers? And also, how wide a scope? I haven't looked into what the Council for Voluntary Service does in the other districts or other councils. I've not looked into that before. How wide is the scope? Is it data protection and background stuff, but also is it helping these organisations apply for grants? I mean, I've recently identified or seen grants that voluntary organisations aren't always applying for, and I just wonder whether there'll be any support from the council to help to help in terms of grant applications. Thank you. Thanks, Chair.
Yes, thank you, Paul. Yeah, if I can just respond to that, and then I'll perhaps ask Jamie as well. I think the idea that we've been running with is not bearing in mind the financial aspect as far as the council is concerned, and knowing that we haven't got loads of money to throw about, you know, to things. However good a cause it is, we still have to bear that in mind. And I think the idea was that when this has been discussed, I think most of us think that a CVS would be, or that kind of umbrella body would be good, but it's whether that's done probably from the community. So, for example, at the moment, at last week's meeting, we had a new worker called Ellie Barnes, who's been employed by I think it's a CCG, isn't it? Where's she gone, Jamie? Yeah. She's based at the Ottery Help Scheme, and she's only part-time, and she's there for a year. But it's the, I suppose, the CCG/NHS response to the fact that something like this is needed. And she's going to be spending this year finding out from local groups and charities what the needs are, and then hopefully to take that forward in a very small way, but at least it's a start and it's a step in the right direction. So that's what we're hoping, that Ellie will find out a bit more than we and Jamie have already found out about community groups, and just see where that leads. So there is some work going on, just to try and be positive about this. There is some work going on out there in the community. And I think we just need to work together with Ellie at the moment and see what she finds out. I mean, I don't know whether John has any thoughts about that side of it, and about, I mean, the impression I've got, John and Jamie, is that we as a council don't actually run this CVS ourselves. Have I got that right? Is that the thinking, that we could perhaps contribute something towards it? And contribute not necessarily financially, but contribute, as we said before, in helping them with perhaps some legal advice, not legal advice, but some advice about what Paul has already said about, you know, data protection and safeguarding and things like that. So sorry, John, I'll let you speak now. Thank you.
Our thinking today has been to probably commission the service. So we've kind of drafted a specification, a loose specification, which is what Jamie consulted on. But there are a number of ways in which we could do that. So it's not predetermined, if you like. And it might be worth, Chair, bringing in Helen, who was very instrumental in negotiating and developing the health work that you mentioned just now, and in fact Helen was prompting me to raise it earlier, because that's a potentially a really good start, the work that Ellie Barnes is doing. But Helen and I think Jamie are very familiar with the project that's only really just started.
Okay, thank you. Thanks, John. Yes, yeah, let me have a look. Yeah, I'm just looking at all the hands. So shall we bring Helen in now? Is that all right, Helen?
Okay, thank you, Chair. Thank you, John. Yes, those of us lucky to be at the event last Tuesday heard Ellie Barnes speak. She was new in post. Jamie and I were heavily involved in discussions with Darren Halifax, one of the NHS staff. So he was instrumental in getting the funding together for her post. Originally, they had wondered if we might contribute to that, but Jamie and I, working with John and Megan, decided that really we'd rather watch what they had in mind for the post, because it was, at that stage, it was quite heavily orientated to NHS support rather than our more broad community aspirations. So I think what we were hoping was that we could work with Ellie for the year, see how the post went, keep reviewing it with Darren Halifax, who's paying her salary. And maybe one option for this panel and other members to consider later would be whether we would want to contribute to that post in the future is maybe something to consider. But Ellie's brief at the moment is to work primarily, I think, with the groups that we would see as very much providing healthcare. So those who did help with the pandemic, the local health forums and so on. So for instance, some of the questions she was getting on Tuesday around would she be supporting environmental groups, at the moment that wouldn't directly be in her remit. Whereas I think our post aspirations, we would be wanting somebody to cover the whole of East Devon and all of the various voluntary groups. So I hope I've summarised that for John and Jamie. Thank you.
Yeah, thank you, Helen. Yeah, thank you. That gives a good background to it. I just want to, Jamie, did you want to comment on what Councillor Miller said or anybody else has said?
I think Helen and John have covered some of it, but in terms of what might this organisation provide, it's a case of whatever the voluntary and community sector need. So we've worked with them in the coronavirus community support groups quite a bit to try and figure that out. What do you need? What do you want help with? And then it's sort of progressing with that, really adding to it whatever Ellie finds out from her health and wellbeing focused groups. So yeah, it's kind of up to the voluntary sector to decide and take that further in discussion with us, really. And yeah, Ellie is a fantastic resource, and I think she'll provide some really, really useful information. And yeah, when I talk about the East Devon missing a council for voluntary service, we don't necessarily want to replace it with a council for voluntary service. We might want to replace it with something else, whether it's be something like Ellie's post or whether it be something inside the council potentially. But it is some kind of Vcse sector support in whatever form that takes, which is sort of undecided at the moment.
Okay, thank you. Thank you, Jamie. Councillor Miller, is there anything you want to come back on that? Is that all right for you at the moment?
Yeah, I was putting it in the chat, but it's very, very short. All I was going to say was that I just wonder, because obviously you've mentioned it, Chair, as a council, in terms of finances, we are in a very difficult position in terms of cash flow and everything like that. But I wonder whether it's the experience of other councils in terms of what you put in. Say for every £1 the council puts in to support the voluntary sector, £2 comes back to the council in savings in terms of having to deal with poverty having reached a really serious stage. I'm just wondering whether there is any research out there, or whether perhaps officers could go away and look at that, because I would just be very interested, knowing how difficult our budget is, to see whether that support is proven elsewhere to help save money for the council, because it is very difficult to justify spending money at the moment. So I'm just interested in that. But yeah, sorry to come back, Chair. It's just
that's okay.
one final thought.
Yeah, that's okay. Good point. Yeah. Jamie, yeah.
I did do a bit of research with several other voluntary and community sector support organisations within Devon, and it's very varied, really, how much the council puts in and how much the council supports it. I mean, to the point where you get to Exeter Connect, which puts in about £1 million. Exeter City Council puts about £1 million into that, and then you get down to another district in Devon that only puts in £17,000 a year to their voluntary sector support organisation. The feedback that I was getting from talking to all of the sort of my counterparts, really, from the districts, was that the people that you get to do it are key. It's not necessarily always about, how much money you put into it. It's the characters and the types of people and the experience of the people that you put into those roles that seem to be more important than anything else.
Yeah, okay, thank you, Jamie. Yeah. Thank you, Paul. Can you tell me, I'm just looking at people outside of I don't think we've got anybody from outside of the panel, have we now, Sarah?
No, we haven't, Chair. So Councillor Desarum is next,
Right.
followed by Councillor Allen.
Okay, thank you then, Councillor Desarum. Bruce?
Good morning. Thank you very much, Chair. I think, Jamie, that was a very positive report that you delivered to us. I have read through some of the comments in the paperwork that we've got, and I have a quick question. Apologies if I may have missed it, but I've got a couple of quick points on items 13 and 14 of the report. I look on item 13 when it said 7 respondents commented that we usually have to travel long distances for good quality training. And I note that we have the climate emergency. So clearly traveling long distances isn't good for us as a climate emergency, but also I wondered whether we would be able to have good quality training. And I note that we've had the Working Together seminar, Councillor Armstrong, which you quite rightly identified as being very good. And I'm wondering if that's something we could put funding towards, good quality training. And the other point that I wanted to raise is on item 14, where it says what we need is focus in the new local care partnership and integrated health system. Hopefully, Jamie, you'll be able to liaise with our county council colleagues so that obviously we target people to the right way to do with the health issues, because obviously a lot of the health issues that we will raise are dealt with by our upper tier colleagues. So that's something that I think we ought to perhaps use this document to work in partnership with our upper tier colleagues. I mean, I presume obviously from what you said we already are doing so, but I think that's something that I have noticed has come out of those notes. So those were very, very quick points that I wish to raise today, Chair, and thank you very much.
Thank you, Bruce. Jamie, would you like to respond to that, please?
In terms of the good quality training, it would obviously be better if they could access that locally. We've had discussions in the coronavirus community support groups about whether our local groups can train each other, because we have such fantastic local groups. There's perhaps one that has so much experience in safeguarding that maybe they could train the others, but they just don't have the time or the money to do that. And maybe with some support from us, they would be able to. And yes, I agree, it's completely the right thing to do to work in partnership with everybody else. Myself and Helen have been talking to Darren quite regularly, and talking to Devon County Council as well and their locality team, because it needs to be a coordinated response, and we don't really want to be reinventing the wheel or trying to do anything that somebody else is already doing. So yeah, this definitely needs to be a multi-pronged approach from all sorts of organisations, which is why we're regularly talking to those people.
Fantastic, Jamie. Thank you very much, and thank you, Chair.
Thank you, Jamie. Yeah, I think the other thing to mention is that there are good examples of this kind of work going on in other parts of the Southwest, aren't there? So Teignbridge, for example, they've got quite a good system going there, and I've not researched that at all, but I'm sure Jamie and Helen are aware of that, and John. So you know, it is about not reinventing the wheel, as Jamie said. I'm very much for that, and learning from others and working with others. So thank you for your questions, Bruce. Is that Councillor Allen next? I think, yeah, Mike, thank you.
Yeah, thank you very much. I've been involved in a lot of different voluntary groups, and I think it is important here that we clarify what we mean by a CVS and what we mean by voluntary groups. And I love what Jamie's done, but I haven't got a clear idea of what the recommendations are from this particular exercise. I think the chart 12 of the report is very clear that things like funding, legal advice, volunteer training and recruitment are very important. There's also the issues of getting correct information, because I keep coming up against people who have been, how can I put it, seriously misled over coronavirus vaccinations and come up with all sorts of weird and wonderful things. And it might really help to have a fact check or a reliable source of information. Plus, where do you turn to? Where are the connections to other help? And in fact, there's a few organisations I've dealt with, like the Food Bank and Honiton Health Matters and a variety of other ones. And Steve Craddock and Helen and the others who are running Honiton Health Matters have an excellent network, which the churches worked with. And that's why we got everything up and running within a few days, as Jamie has pointed out. It was that there were people there who trusted one another and got on well. And that is absolutely key. So whether or not a CVS across the whole district would be of benefit needs to be clearer to me before we start putting proposals together, because town by town, there are some fabulous organisations in Axminster, in Sidmouth, in Exmouth, in Honiton, in Ottery. They're already there. And what we don't want to do is get in the way of what is already working extremely well. I remember when Sarah came to me with the idea of parental minds, one of the things that we looked for was where can we get support for help for parents in the middle of a COVID lockdown and the mental strain that they were under. And it was a very good idea, and one that developed with pulling in support from key contacts. And I think with people like Jamie there and Sue Buse and others under John's leadership, we have a lot of excellent contacts. And it would perhaps, along with the meeting that you mentioned last week, be a good thing if we made sure that people knew how to make some form of positive engagement with the council, with the right officers, if they've got a brand new idea or a really good opportunity as an established voluntary network. We've also had the situation in Honiton in particular, where TRIP has periodically struggled with sudden changes. And it's those sudden changes that may need a small amount of contribution. So I do recommend that we think about an emergency fund for key needs. And I strictly mean emergency, so that some really important charity that does a fabulous amount of work doesn't go down just because of a sudden cash flow crisis. I hope that's a good contribution to what is an excellent report, but I do think that whatever we do, we need to help coordinate what is already excellent out there rather than interfere. Thank you very much.
Thanks very much, Mike. As usual, you raise a lot of questions and put them quite succinctly, so thank you very much for that. Jamie, can I come back to you first of all, just to let you comment on what Councillor Allen said? Thank you.
Yep, thank you. Sorry, I was making some notes there. So in terms of what do we mean by a council for voluntary service, it would be a registered body that is registered as a council for voluntary service. And in terms of voluntary groups, it would be the Vcse sector, so any not-for-profit sector really, so voluntary community social enterprise groups, anybody that doesn't make a profit. Or they, social enterprise groups can make a profit and then reinvest it back into the running of the organisation. But we don't necessarily want to set up a council for voluntary service. It may be, as you've mentioned, that there are some good local groups or a selection of local groups that could provide this support. It could be a grassroots organisation. It wouldn't necessarily be a council for voluntary service as we know it, really, as tradition dictates happens. And yeah, we would work with the voluntary sector to try and figure out exactly what it is that they want. They've given us a lot of ideas already, and they seem very supportive of us providing some level of support, but we could work further with them and get information from Ellie Barnes, as already discussed, to try and sort of hone in really on what is wanted. And we certainly want to work with the voluntary sector and not do anything to them. We want to take them with us on this journey, which is what we've been doing some of so far. In terms of what you were saying about brand new ideas and how do people make this happen, how, you know, Sarah Lou from Parental Minds has done an amazing job setting up mental health support in Honiton and surrounding areas. The voluntary sector support or organisation or whatever happens could help provide this and improve engagement with the statutory sector for voluntary and community groups. So it could be that is one of this support's aims, really, to try and help voluntary and community sector groups set up, because it is an area that we don't currently cover. And there, I don't know if you're aware, but there is funding available currently from Devon County Council for charities and not-for-profit groups around coronavirus. I think it's called the Recover Fund or something. They have money available to help groups that are in dire need at the moment. It's a fairly quick turnaround time as well, which is great. So that's available. And I do have a proposal going to the community grants panel on Thursday about potentially setting up a small grant scheme in East Devon for not-for-profit groups around a wide variety of things that would support our council plan and support the poverty strategy, but that's still to be discussed by members on the community grants panel. And that money would come from money that's already set aside for the crowdfunding grants that we already have and give out. So it wouldn't be a new budget, it would just be diverting it from one little bit of funding to another. So I hope that's helpful. Thank you.
Thank you, Jamie. Yeah, that latter one sounds like a good idea, because I know with the crowdfunding, it can often be quite difficult for groups to get that organised, and it can be quite a lengthy process, can't it? So I think that idea of moving the money around so it's more easily accessible, I think that sounds like a good plan. Councillor Allen, was there anything you wanted to come back on with that, or any other questions?
Yeah, all I wanted to come back on is to mention Helen Waring's excellent work as well. What I'm really saying is we have some really excellent officers, and we just need to make sure that the voluntary groups can access the right person, so that we could do something like tweaking our website just to make sure that it's easier for these people to be found. Thank you.
Okay. John, I didn't know whether you wanted to say anything, but what I would think on that, I think as far as the voluntary community sector are concerned, I think the first point of contact would be Jamie. I think that's the first point of contact, because she's got contact with Helen, with well, all our other officers really, but I think she's the first point of contact, and it depends what it is that you could, well, I'm probably putting words in your mouth, Jamie, but perhaps you could redirect, you know, anything that comes forward to you. If you felt that you weren't sure who to direct it to, then you can pass it on to another officer or whatever. But also, I think we can't emphasise enough that she particularly and Helen will be working with Ellie Barnes that we mentioned before. So yeah, I think it's important to have that conduit. John, did you want to comment on that?
Yeah, thanks, Chair. I mean, I really appreciate Mike's input, because he knows what's happening in this area. He's done a lot of work in this area, so really value the input. And like Jamie, I've made a few notes. I absolutely agree that where we get involved, we need to add value to what's being done and not impose our kind of our will, our desire on groups that are operating perfectly well at the moment. I suppose the one issue I'd be a little bit concerned about is in terms of capacity, really, because I think it would be fair to say that Jamie, Helen, myself and others don't really have the capacity to provide the level of support that some groups might require, particularly if starting up or looking for funding and things like that. So what I would hope is that if we do commission a CVS type organisation, that they have that capacity to provide the support in those areas that the groups have identified to us, some of which have already been mentioned, that they can actually provide real hand-holding support through some of that minefield of whether it's DBS checks or safeguarding or GDPR type things. That's what I would hope that we commission, on the understanding that that's needed by the groups. Thank you.
Yeah, thank you, John. Yeah. Does that help you, Mike? Is that okay?
Oh yeah, absolutely.
Thank you. We like to keep you happy. Like to keep everybody happy.
I hope so.
Sarah, was it Councillor Woodward next?
Yes, Councillor Woodward, then Councillor Jarvis.
Okay, thank you. So, Tony, if you'd like to comment, thank you.
Thank you, Chair. Thank you very much. Just coming at this from from the perspective of mental health services and health and well-being, and also picking up on two words if we've just been used, which is conduit, and also around communication. And it seems that there are such excellent voluntary groups around, but we don't necessarily know who they are, all of them, who they are and what they're providing, and there may be duplication out there. And also picking up on Councillor Desaron's point about training, in that we could have an excellent training arrangement locally, but we may not be inviting people or that would benefit from that. So I think if there was some form of database of voluntary groups, so we could have not the CVS as in other areas, but one that could at least provide support to, or at least have the facility to know which groups are out there, then I think that would be a good thing that we could provide. And just in that context too, we still have the mental health officer role, which, as I understand, is still unfilled, but there could be some capacity for drawing together, certainly from the mental health and well-being side, some support there going forward. So yeah, I think knowing who's there, knowing, and it's a two-way thing. They all know who to contact at East Devon, but we could also help support somebody in providing knowledge about what voluntary groups there are and what they might need. Yeah, fine. That's it. Thank you very much.
Lovely. Thank you, Tony. Thank you. Jamie, I know that you and I have discussed this at length, haven't we, about having the database ever since I started doing this role myself, and it's not quite as straightforward, is it? Anyway, I'll let you you answer that, and yeah, thank you.
Yeah, something that we've had discussions about. There is no database of voluntary and community sector groups in East Devon. Devon County Council have Pinpoint, which is supposed to be something like that, but it isn't. It's very out of date. It's incomplete. There's a lot of irrelevant groups on there, so we don't use that because it's it's not really usable. It's not very good. And it is incredibly hard to get together that database of voluntary groups and then to keep it up to date and to keep it relevant and make sure it's all complete. So it would kind of be a massive piece of work. And the voluntary and community sector support side of things is just something that I've picked up in addition to my normal day job, really, which is consultation and managing some of the council's funding streams. So it is a very small part of my remit at the moment. So yeah, it is a massive piece of work that sounds relatively simple. I know that there's some work being done by Housing John's community development workers, specifically in certain towns, but they again have limited capacity and remit because they're employed by housing. I know they're doing some fantastic work and are aware of quite a lot of groups, and I work with them regularly. So does Helen, where we've actually got a meeting with them this afternoon to try and catch up on what they're doing and what we're doing and try and work together. So yeah, they're doing some of it, but it is a massive piece of work. So it's something that, as I think is in John's discussion paper, that we would want any voluntary community sector support person or organisation to do as a matter of urgency, really, just because it is so time consuming and we don't necessarily have the capacity to do it fully ourselves at the moment. Hope that makes sense. I don't know if John's got anything to add.
Thank you, Jamie. Yeah, John.
Great points again. Thanks, Tony. As Jamie's indicated, keeping up the kind of register or database and doing the signposting is probably a full-time job in itself. And that, again, that's, as she said, part of our specification for commission service would include some attempt to do this, because I think it is important that we've got good visibility of the groups that are out there. And just to reassure, hopefully, Tony, and I see the leaders on the call, we've gone out again for the recruitment of the mental health positions, proving quite difficult to fill. I think this is the third time we've gone out to recruitment, but I'm keeping my fingers crossed that we get some suitable applicants. Thank you, Chair.
Okay, thank you, John. Thanks. Tony, is that all right for you? Was there anything outstanding that we've not answered?
And that's fully understandable. I think that was the same position. I know we mentioned that a year or so ago, that Pinpoint wasn't very good. But I think that there needs to be some basis upon, as Bruce mentioned, if we're having training, you need to know who to invite. Otherwise, you just may cover half.
Yes, of course. Yeah, understood. Yeah.
See, we need to.
I think that's something that I would like to pursue a little bit more outside of this meeting with Jamie and perhaps John and one or two other officers, as to how we might be able to progress that a little bit, bearing in mind that we don't have much capacity, if any, really. But there may be another way of doing it, and I've got one or two ideas. So, yeah, thank you for raising that point. Okay, thanks a lot. I think it's Councillor Jarvis next. Paul?
Thank you, Chair.
Oh. Councillor Jarvis did say he might have a problem with his internet connection today. So, Sarah, can you see anything that I can't see there?
No, I think he's possibly lost connection temporarily.
Shall we just move on then?
Yes, Councillor Chapman has her hand up next.
Yeah, okay, thank you, Maddie, thanks. And we'll bring Paul in afterwards.
Thank you, Chair. Yeah, I do agree with Mike, and I do agree with a lot of being said, and well done, Jamie. As well as the community groups, we've also got small neighbourhood groups. So I can understand the problem, and I agree that we mustn't do anything to put off these groups and their commitment to helping each other and helping the community. I think it's worked absolutely wonderfully well. I don't agree with perhaps getting an officer for the whole of East Devon, because it is such a diverse area, and I don't think that would work terribly well. I do think training is perhaps the way we could go with legal advice, safeguarding, and things like that. And I don't know if we start off with the groups that we've got, and then they contact other groups and it grows a bit like Topsy. Maybe that's the way it will go, but to try and contact every small group that has been helping each other during the pandemic. I mean, we've got a group in my road and Barrowdale, and the couple that have been running around doing shopping and things like that, lads have done really, really well. And they've probably not come on the radar at all. But if they could go into another group, if this is what they want to do and they could get the training, Yeah, I think that would be wonderful. I don't like the idea of sort of targeting just the big groups and putting them in control. I think that would put the other groups off. But if they can come to us and get the training, then I think that would be wonderful and a step forward, Chair. Thank you.
Thank you, Maddie. Thank you. Any comments on that, Jamie?
Yeah, sorry, I was just making a few notes. Yeah, it's great that there certainly is a hell of a lot of voluntary community sector groups, from very small to very large within East Devon. Just to say that in some places that kind of linking has already happened. So Honiton Health Matters and the Honiton community have got together and they have a list of their groups on a website. And Sid Valley Help also has a list of a lot of the groups within the Sid Valley that's already available. But that's just 2 towns. There are a lot of towns and other rural parishes and villages within East Devon that aren't that we don't know about, and that there are probably groups within Honiton and the Sid Valley that those particular organisations don't know about and aren't publicising. And yeah, to try and contact every small group would be a mission, which is why it might be better if we're looking to put in some VCSE support to do it from grassroots, because they're the local people, they know their local area, so they find it easier to get in contact with those groups, and East Devon Citizens Advice as well. So there are various organisations that have some lists, but there isn't one overarching list, and most of those lists may be a bit lacking. So yeah, just to add that really.
Okay, thank you. Is that all right, Maddie? Anything else?
No, I'm fine, thanks, Chair. Thank you.
Okay, thank you. I think Paul is back with us now. Councillor Jarvis.
I jinxed myself, Chair.
You just dipped out at the wrong time. You've been waiting all this time. Sorry about that. Anyway, if you'd like to speak now, thank you.
Hopefully I make sense, because I'm getting tired of this internet business. I'm going to address this to Jamie. I think that's the best way to do it. Jamie, with assisting these organisations, and hopefully you caught what I said before about we have established voluntary groups, charities, etc. We have a lot of new ones that were formed recently. They're doing a great job providing the service, but they need assistance with training of their volunteers, recruiting of their volunteers, safeguarding, data protection, etc., things like this. I work for a charity, and COVID made things very difficult for us with volunteers. Government rules about how they were trained as well, that they needed on returning to us to have such training as data protection, safeguarding, working safely as volunteers, etc. As an organization that has 4,000 volunteers in the retail and the medical section, how would we provide that? Because they couldn't come together. How do you train people? They came up with a cheap and simple solution for such things as data protection and safeguarding. 30-minute videos, which are cheap to be made. They could be made by one of the organizations that maybe are willing to do so. Maybe reach your hands out to some of the larger charities that have had to do this, such as mine, Hospice Care, to get an idea, because none of the information that is in the videos is confidential. It's just basics on safeguarding and data protection. Maybe that is an option that we could do on certain subjects, offer 30-minute videos. The volunteers then have to absorb that and then take a little test afterwards to prove that they've understood what the information is before they can continue to work with us. Did that make any sense, Jamie?
Yes, thank you. Yeah, that's really, really good thoughts in terms of looking to larger, more national charities and seeing their videos. That would be really useful. Thank you very much. Yeah, I just made a few notes as well. Thanks.
I could talk to my organization, because they've covered 5 different things, including infection prevention and control, safeguarding, data protection, the particular organization's values, so the people who are joining understand that. I could probably have a discussion with the person that's organized this, which is our head of volunteers, and see if they'd be willing to have a discussion with you and maybe let you see some of these videos.
Yeah, that would be great. Thank you.
Just to give you an idea, because they can be, with our organization, we took a massive financial hit. We couldn't pay outsiders to be doing this information for us, so it had to come from in-house, and it was done relatively well with the different expertise of the different sections of the charity.
Mm-hmm. Yes, thank you.
Thank you, Paul. Can I just ask whether you had any feedback from the volunteers and whether they thought it was a good way of doing that? Did they? I mean,
to be perfectly honest, in the beginning, a lot of the volunteers, a lot of them are elderly, at least in the retail side of it, they were offended. But certain things like data protection are things that they have to do. We have to do by law. We can't just let people roam about the place. Safeguarding is another issue that is controlled by the national government. It's not something we've thought up ourselves. So once they realized it, originally they were trying to invite them to small meetings, or that they would sit by themselves at home and watch these videos. Then it was turned around and said, no, they could watch them not with me, but in the confines of my workplace. But a lot of the volunteers we're talking about aren't senior citizens. They are young, vibrant people. That means nothing. I'm not criticizing anything or saying, but of what I've seen here in Budleigh with the organizations that have popped up, a lot of people are computer savvy. They can sit and log in at home and watch these things. They don't need somebody to turn the computer on for them and set up the videos. So once they got the hang of it and they realized that it wasn't any form of criticism of what they were trying to provide us, but it was just certain things that we had to make sure that they understood, such as data protection, safeguarding, especially at the moment, infection control and prevention too. It was simple things like that. And once they sat and watched them, they got a better grasp than sitting in a room with a group of other people and somebody, at the podium talking to them, because that's very distracting. When they could sit and watch the video by themselves, and they could watch it again if they thought that they didn't capture something, it gave them a much better grasp. And in the end, they were all happy to do it. And they actually took a lot away from it that they may not have known. So simple things like data protection, the amount of fines that can be levied against an organization, things like that they would not have known. And if somebody at the front in a podium was going, well, £20 million worth of, it just doesn't go in because of the distractions. The video was a much better way of doing it. And that's how we're going to go forward, even outside the pandemic.
Yeah, well, thank you for that, Paul. It's certainly something for us to think about, isn't it, Jamie? Thanks a lot. I don't think we have any more hands on that point. We've spent quite a long time on that, which is very, very useful. So I'm hoping that you've got some sort of feel for what the poverty panel members are thinking, Jamie, and we can follow up afterwards and discuss further with John and any other officers. Okay, is that all right? But thank you very much for your great report. Anyway, it's very enlightening. Okay, thank you. So we're now on to item 6, new household support fund. Briefing paper from Libby Jarrett, Service Lead, Revenues, Benefits, Customer Services and Corporate Fraud. Libby, if you'd like to share with us this new support fund, please. Thank you.
Yes. Thank you, Chair. I have actually drafted a briefing which I can circulate, that can be circulated as part of the minutes afterwards.
Oh, thank you, yeah.
And I'm sorry I wasn't able to get that out before. So it's just some background on this, because I know a lot of you will be familiar with this scheme. The government have launched a new household support fund to support those most in need this winter, 500 million nationally, The funding has been distributed to county councils and unitary authorities. Devon County has received just a little more than 5 million. And the guidance that has come along with that scheme is that county councils must work with their district councils and other local partners in developing local schemes. The funding must be spent by the 31st of March, and authorities cannot carry forward any underspends. At least 50% of the funding must be used to support households with children, and the funding is paid in arrears, and it's subject to receipt of certain management information that's required. So what can the funding be used for? It's for households that are facing hardship this winter, helping with immediate needs, for essential things like food, energy, water bills, and other related essentials. It can also be used to support wider essentials such as boiler servicing, repairs, blankets, equipment, broadband, phone bills, essential transport related costs, could be repairing a car, and in exceptional circumstances, it can be used to support housing costs where existing housing support schemes, so that's your housing benefit and the housing costs within universal credit, do not meet that exceptional need, because as you'd probably be aware, we've got discretionary housing payments as well. So normally that would be that sort of emergency support, but they have allowed for it to be used in that instance as well. So what are Devon County planning to do with the funding? Well, there is going to be a household support scheme that where some of that funding will go to the district authorities to run a hardship type scheme like we've been running up until now. And again, to support people who are struggling to secure food, water, energy and other related essentials. They're also going to be providing funding for school, a holiday voucher scheme to cover the Christmas holidays, the February half term and the Easter holidays. So each child that's in receipt of a free school meal will receive a £15 voucher that will cover a week's holiday. So obviously over the Christmas period, they'll get a £1 voucher. And alongside that, and those vouchers will be distributed automatically. Alongside that, they're also going to be using some of the funding to provide a one-off £30 voucher per eligible family of the free school meals. So it's an additional amount that they will receive to help the Christmas period as well. Other gateways that they're planning to use the funding. So some of the funding is going to go to Citizens Advice Devon for an energy relief scheme. And this will provide support for those on prepayment meters who are struggling to meet their fuel bills. That hasn't gone live yet, and we're still waiting on the criteria for that scheme. Funding will also go to the HAF programme, the Holiday Activity and Food Programme, Devon Community Foundation, there's going to be grants there, Action for Children's Centres and Early Help Locality Teams will also get access to some funding. There's also going to be funding for the food and recipe kit boxes and funding to go to help homeless and Black and minority ethnic groups who they've traditionally found hard to reach and connect with. So there's lots of different schemes. Some of them are still being worked up, so more details will emerge. But just focusing back on our scheme, so we've received £142,000, £286 to run our hardship scheme for East Devon residents. Devon County allocated in total 880,000. The scheme went live a week ago, and it is to help support the types of things that we've already been supporting through our hardship scheme. So the form is live. It's called Request for Financial Support. It's a generic form. So rather than create another form on our website to support for this fund, we've got one generic form that covers all of our discretionary, well, not all of our discretionary, but it covers things like our discretionary housing payments, our existing hardship form, exceptional hardship funds, so if people are struggling with council tax. So the aim of that was to try and remove barriers and duplication so that a resident wouldn't need to apply under each separate scheme. We capture the information once, and then we work out what support we can support them through under the different schemes. So we've spent quite a bit of time adapting that existing form to support this new household support fund, but also alongside that to get better management information that we can then share back with the poverty panel about what the residents' needs are and what we're seeing and what patterns and trends we're seeing from those applying for the supports under those discretionary funds. So I'm going to get Sharon to talk to you a bit more about how many claims we've had and the sort of management information that we can will now be able to glean more easily by having this set up in this way. So we're very keen for this fund to support the aims of our poverty strategy in building financial resilience. So although it is about providing immediate support with food and other essentials, we also want to make sure that we're not just treating the symptom, but we're also looking at the underlying cause that's creating that poverty. So yes, we need to support that immediate crisis, but we're really keen to ensure that we're looking to understand root causes so that we can help to address those, hopefully. As part of the claim process, we've tried to keep the claim process relatively simple. There will be a telephone interview as part of that with one of our officers, so we can understand that wider need and hopefully look to link them in with other organisations as well to help address, again, that root cause. So this sort of data dashboard that we're looking, I talked about getting better management information. It is on the Poverty Action Plan about having a poverty dashboard. And we see this data forming part of that dashboard because our own data is quite powerful in what it can tell us about issues within the district, the types of demographics, and how we can look at sort of future patterns and trends and how that can help to inform future policy and interventions, as well as also the sort of organisations that we are linking in with to help address some of those wider sort of issues. So I'm just going to pass you over to Sharon. I don't know, Sarah, if you can make her a joint host, because I know she's got a couple of slides.
I can't actually see Sharon in the participants list. Is she on the call, Libby?
She should be.
I know she had the invitation. She doesn't appear to be in the...
I am on the call, sorry.
Oh, I beg your pardon.
My iPad. It renames me to
oh,
different
sorry,
people. I
you've
am
been
sorry.
renamed incorrectly. As
Yeah.
We'll rename you, Sharon. Sorry
Thank
about
you.
that. Thank you.
So if you're happy for Chair for me to sort of pass you over to Sharon, she will be able to give an update on the applications we've received over the last week, what that sort of the dashboard we're looking to develop around this household support fund, and the work that we're doing team are doing, the financial resilience officers, in linking in with other organisations. So thank you.
Yeah,
Sharon.
thank you, Libby. Thanks, Sharon. Okay.
Okay, thank you. Libby, would you mind awfully if you shared the slides? Would that be okay?
Oh, fine. Yeah. Hang on
Sorry.
a second.
Thank you. Or present them.
Yeah, I don't.
Sorry, well, I'll start while we're waiting for slides. So as we have to report our spend back to Devon County for the DWP, we kind of took the opportunity to link all of our reporting to our poverty dashboard so that we could collect and analyse the work we've been doing on the financial resilience team, as well as being able to feedback on our figures. Now when we have a look at the slides in a second, but at the end of our first week of the Household Support Fund going live, we have received to date, well, at the end of yesterday, we received 90 applications. And around 28 of those applications came in following the communications that were sent out in the residents' newsletter on Friday. We have made 35 awards so far and paid out £3,515. And the majority of that has been on food, followed by energy and water. And 63% of all the awards made have gone to households where there are children resident in the property. We've had 65 of applications have come from single people, and 32% of those are from single people who don't have children residents. So that's starting to support our previous data that we've fed back into the panel previously about our single people really struggling financially. We have had 41% of our applications have come from households where someone is receiving a disability benefit, and 21% are from carers. And that 21% includes all those who are carers, but not just those in receipt of carers allowance, which is giving us a better picture in terms of data, as those residents were previously hidden from us. So the officers will complete further actions and record outcomes as they're going through the cases, and that's going to help us better understand those root causes of hardship and poverty. We can also see that 24% of our applications have come from people in work, and of those 24%, 38% are in full-time employment. So we're currently working on being able to drill down further on our data so that we can understand things like household makeup and housing status, income and expenditure shortfalls, and what people in full-time employment need in terms of support. Have we got the pages at all to, sorry.
Sorry, I'm having problems presenting. I've just emailed them to Sarah. Sarah, is there any chance you could present them for me?
Can I just ask, whilst we're waiting for that, Sharon, will we be able to have this information afterwards, please?
Yeah.
So that we can, because there's a lot of statistics there, and I'm trying to write.
Yes, it is. Yeah, they'll be in the brief. They're in the briefing note that Libby will be circulating.
Oh, yeah. Okay. Thank you.
With the stuff. Yeah. So I realise there's a lot of data, which actually the dashboard, as you can see now. So these figures are actually from Thursday of last week. So they have increased since that point, and we've taken the figures that I've given today are for the full week, because the dashboard will refresh overnight. So this was only up to Wednesday. Now you can, so out of the 90 applications we've dealt with so far, we've had 24 of those have required additional work. And we do still have 39 new applications outstanding. So that number is likely to be a lot higher. And at the point when we created these screenshots for you, it was actually showing that just over half of all cases needed further resilience work on them. And if we could move to the next slide, please.
Sorry, I seem to be having problems with this as well.
And it will be, so these are just screenshots of what the dashboard's going to look like. All of the pie charts are interactive, so you can hover, you'll be able to hover over them and pull out what each percentage is related to. It really is just a kind of a snapshot just to show you what we've been working on. So this page is actual awards that have been made, whereas the previous page was all applications received. And then if we could just move on to the next page as well. Now this is very much a work in progress. We've literally just started getting to this data, but we can see, so out of those 90 cases, the 24 requiring additional work. So the referral reason, firms get referenced by referral reason, that was showing us today as 50% of referrals coming in as a result of being unable to afford food, and 25% of those were unable to afford energy. And that's the presenting issue that officers record as the reasons for the further work. And it does support our approach that our discretionary funds are used as tools to address poverty and support that wider work, making the difference compared to just addressing the immediate need. So, for example, like struggling to afford food and energy is a symptom of poverty and financial hardship. It's not the root cause of it. And just providing that financial support for one of the symptoms makes it more likely that people will need ongoing financial assistance, as it doesn't really solve the underlying root cause. And as you can see, we're going to be plotting on a map and linking it in with our council tax billing data so that we can really understand where those areas are and where we can target our support. We will continue working with our partners to support us and help us identify those residents who wouldn't normally apply for the funds or would go elsewhere for support. So, for example, we're still working closely with citizens of Vcse Devon, and we've been talking to ECO last week about working with them via our private sector leasing team to help us use those funds for the wider essentials, such as white goods and the boiler repairs, because they are the experts in that area. And we also are continuing to work with Devon County on the Team Devon for the Household Support Fund to carry on that learning and also to start discussing wider poverty issues with them. And so in terms of communications, we're going to be looking at fortnightly social media posts, along with future press releases to promote the fund. And we'll be giving the further update on our spend and data that we've gathered at the next poverty panel in January. And I think, well, I hope we're going to be able to present this dashboard to you early next year. So that's kind of it for a quick update, really, on where we're at.
Thank you very much, Sharon. Thank you.
No problem.
That's brilliant. Yeah, a lot of work gone into that. A real lot of work for all of your team. So could I ask Councillor Miller? I think you have a question. I was going to mention to you as well about your, and you're probably going to raise it, about your motion and how that fits in with what your motion was about. But I'll let you speak. Thank you very much.
I was going to touch on it. Firstly, I was going to echo what you said, Megan, and what a lot of hard work will have gone into this from the officers, because I mean it's frustrating from my point of view, because what the central government do is they rip up one way of supporting people through universal credit, and then they introduce a completely new scheme, and it takes a great deal of work and council resources to set it up. And just from listening to the report there from Sharon and from Libby, it actually, my concern in some ways is it's quite, I mean, the claim process, I'm welcome the fact that it's relatively simple, but there are a number of different pots, I think, from what I can hear in terms of applicants going for it. I'm also worried as well because, and the dashboard, I really welcome the dashboard, but I couldn't make out there how many people, there was a pie chart. I couldn't work out who was in employment and who wasn't. I worry as much for the people who are actually families where the one parent or more are actually in work and needing this money. And the reason that is because it takes, these applications for benefits take a great deal of time for people, regardless of whether it's relatively simple, you know, having to attend the telephone interview, etc. You know, when somebody's in work, that's really putting even extra pressure on them. And we also know that people's experience with the benefit system over the last 11 years really hasn't been great. You only have to look at the scandal that is the personal independence payments that disabled families have had to go through in the past since 2010 to see how intimidating the system can be for people. So one of my questions was that obviously we've had 90 applications, it's gone through the residents' newsletter, but how many people in the district read our newsletters? Have we done any other press releases? I apologise if I should have seen this, or whether it was mentioned at the start about the report, because I did have some technical problems, so I missed the very beginning of the report. But is there any way we can advertise this household support fund even more widely to people? Because I realise not everybody will be reading the residents' newsletter. And as predicted, regarding this urgent report for next cabinet, I just was noticing it's not on the next December agenda. And I just wanted to take this opportunity to ask, given that this household support budget, the money coming down from government is nowhere near the £20 uplift for people on universal credit, when you compare even in Devon, the amount people getting, are we going to have an urgent report to cabinet either in December or January in terms of looking at whether we need to locally create some kind of pot of money, not necessarily to use, but to rely upon if we need to use it over the winter, in the expectation that obviously the household support fund, from what I've read, please correct me if I'm wrong, it just doesn't seem to touch the sides in terms of the support that was being offered. And of course, as we've all seen, the rising cost of living is significant, and it's really worrying. Fuel costs, all kinds of things, and household and housing costs as well. So, sorry, there are a lot of questions there. I apologise for that, but thank you again to the officers for all the work with the report, and I hope those questions aren't too difficult. Thanks.
Thank you, Paul. Thank you. It's Sharon or Libby who wants to come back on the points that Paul has raised there.
I can. I'll answer some of the points about the dashboard and the communications. So we've got the dashboard. It will allow you to hover over pie charts, and that will give you breakdowns of where of kind of who's in employment, who's not in employment, and you'll actually be able to click on those, and that will actually break the data down a lot further. There's going to be an awful lot of data that our financial resilience officers collect at the moment, that really gets to those root causes of poverty, and that's all of the data that was in the poverty action plan that we said that we would report on. That's going to be available on the dashboard. So we're just working to pull all that together at the moment. So hopefully by the beginning of next year, we'll be able to have most of that in place, which obviously will let us understand households who's really struggling, where we need to do extra to help, the reasons for that, and then hopefully we'll be able to feed that data back up that we can use for other things such as lobbying or speaking to partners about. In terms of communications, we're doing a post have gone out on Twitter and Facebook, I believe, which is just about, that does have the newsletter on there. But we will be doing fortnightly social media posts as well through Twitter and Facebook, with just a flyer type post that will be, we'll switch them around, but there'll be things like, does your boiler need fixing? Are you struggling to pay your heating bills, or has your washing machine broken? That kind of thing. So it will be a different target each couple of weeks. And Devon County are also doing quite a lot of communications and posts as well, and trying to reach the community groups that are traditionally harder to. So, and I think they're looking at doing a newsletter, a piece in their weekly school newsletter as well, to hopefully try and reach a lot more people. Libby, would you mind answering about the report?
Yes, no, I am conscious, thank you, Sharon, sorry, Councillor Miller, that there is a ask for a report. It's not, unfortunately, I'm not in a position to get that on the December, but I have got a meeting later with Simon Davey to discuss getting a report on all the discretionary funds that we have, to give a better visibility over that. Just so you are aware, there's still the £100,000 that was set aside back in April, I think it was, when it went to Cabinet, for work around hardship. We haven't drawn on that yet, so there is still funding available. What we've found is there's been additional discretionary schemes that the government have provided funding that we haven't needed to tap into that yet. So there is that should this funding not go far enough, that we can access. But yes, conscious that a report was asked for, it is on my radar, and the aim will be hopefully to get this to the January Cabinet meeting. Just in terms of, just adding to what Sharon said, because I know you mentioned about the lengthy benefit application, part of our thinking was, by not turning this into a heavy benefit application process, which is why it is a lot lighter touch, which is something that we've been working with Team Devon over, to not make it hugely onerous and to keep that much more light touch. And that the purpose of the sort of telephone calls is to really sort of do some of that sort of understanding about what some of those issues are, and some of the work that the team have done even before the new household support fund is by doing some of those benefit checks that people might be on, actually picking up those things that people didn't even realise that they're entitled to. Actually, they've massively helped with that. So we are really aware. We administer housing benefits, so we know how difficult that can be, and so there's lots of different ways we can support our residents without making that a barrier. So I'm really conscious that we've tried to do as much as we can for it to be as light as touch as possible, but obviously clearly we've still got to duty over protecting public funds. So there does have to be that balance. I think Sharon's touched upon the comms. Yes, we do need to keep a watching brief over that. That's obviously we only been live a week, and that will be constantly reviewed as part of those meetings with Team Devon. It's really important that it's coordinated as well, so that we're not working in isolation with others, but also recognising some of the interventions that we can do. So obviously Sharon's talked about linking in with the private sector team over referrals through ECO, but we can also look at our own council tax arrears data, and we might be able to look at doing some targeted communications on top of the sort of the general publicity. So they're all things that we will be sort of picking up now we're live in looking at how we can better support and get publicity out there on the scheme. So hopefully that's helped.
Thank you very much, Libby and Sharon. Paul, is that all right for you for now?
It is mostly. It's just that final thing on the comms. Just wanted to make the point that, as you'll make the same point, Chair, I know that not everybody is on Facebook or Twitter, and there are certain parts of Facebook and Twitter that people don't look at. I just wondered, I obviously know you have to work with Devon County over a coordinated approach, but is there going to be a press release going out? So there's also things going into the newspapers. They put things online and they're shared across social media as well. I'm just conscious there are so many people that don't see these things, hence my question on the residents' newsletter. And I know you won't have an answer to hand on how many people read that right now, because that's a difficult statistical question. But I anticipate that there'll be so many people who need this that don't know about it. And I know there's limitations in how much communications you can do. I just wanted to put out there that I think we should be, with Devon County, exploring every single avenue in terms of including the local press and the local newspapers that deliver through people's doors, so it reaches absolutely everybody, or everybody that might need it. Thank you.
Thank you, Paul. Yeah, and the other thing quickly that strikes me is that although £142,000 seems a lot, it's not actually a lot, and it's how if we reach the end of that funding, what happens then? So that's just we don't know, presumably, but that's just a concern. Yeah. But thank you. We better move on. So we've got Libby. Did you want to come back on that? I see your hands up.
Yeah, I just wanted to add that should we, Devon County are still holding on to a small balance of that 5 million that hasn't been allocated, and their intention is to do a review after Christmas to look at how the funding's gone, and if we're in that position that there is a need for more funding, then I think they are open to exploring that with us. So I think these schemes have had to be set up at pace. They were only announced in October. The scheme guidance was only finalised about 10 days ago. So it's it has been sort of something that has had to move very quickly. But I do absolutely take your point, Paul, over about getting this out there to as many people and in different medium forms, because we know that not everyone is signed up to the residents newsletter. Schools will be a good one that will reach a lot of families. We're really keen, and Devon County are, that they're not just promoting the free school money vouchers to schools, but also about this hardships household support scheme as well. We work closely with Citizens Advice. They will be very aware of this scheme. So if they're getting people accessing through the prepayment meter scheme, that they would also link us. So yes, there is work that we need to do, and we will keep that under review.
Thank you very much, Libby. Yeah, okay, thanks, Paul. Councillor De Sarum, thank you.
Oh, thank you very much, Chair. Yeah, just touching on what we've said, I think Sharon has provided a very good dashboard, and it's very, very interesting to note that food need hardship comes out quite high at the 1635, and Councillor Miller was talking about how we get it out to people. Well, I think that you and I, Councillor Armstrong, may recall, we both attended the Gas Safety Week a few weeks ago, and I'm wondering whether, because obviously this panel likes to propose practical steps, and I'm wondering whether, when COVID permits, we could actually do a series of roadshows in the various places, towns that we have within East Devon, to actually promote this particular issue and show our concern for food and energy issues. Obviously, it's about getting the message out through newsletters and all the rest of it, but clearly there's nothing quite like face-to-face interaction. As you know, we went along to Gas Safety, took part in their gas activities that they gave us, and took away a little goodie bag. So I think that's a way of actually encouraging people to attend. If it's well publicized, it does bring people along, and it promotes the work that we're trying to achieve. So I would like to put that forward as a practical step to the committee, to be considered if of course the COVID measures make it possible and practical. Thank you, Chair.
Thank you, Bruce. The only thing I think of on that, so it's a good idea, is that as I understand it, this funding is only until the end of March. So by the time we organise something like that, the possibilities may not be there anymore, but I might be wrong on that, if anybody wants to comment. Libby, have you put your hand up? No, that's all right. Yeah, sure. So yeah, but thank you for that. Has anybody got any comments on what Councillor Desarm has suggested? Or shall we move on? We'll just bear that in mind, Bruce. That's all right.
No problem. Thank you so much, Chair.
Okay, we've got a note of it, and we'll see what we can do. Thank you. Councillor Allen, thank you.
Thanks, Maggie. It does seem that with 142,000 plus the 100,000 backup plus further funding from Devon if we need it, that we've got all the emergency issues covered at the moment. The problem may be, as Paul was saying, that the problem may be that we're just not getting the engagement of the people who need it most. And I do recommend very clear communication to the food banks, because these are obvious, often the first port of call for people who are in serious trouble. And it would help if they could have early notification of some of these schemes. I've done my best to send the information on to the Honiton Food Bank, but I am always left in that uncomfortable feeling of have they actually got the official notification from John and Libby and others? Because the food banks and our efforts to get through these emergency situations, they just happen. I mean, it's not just the change in universal credit. Sudden changes in rent are also serious problems. If you suddenly lose a job, that's when we need these kind of funds. And so I'm absolutely delighted with the way that Libby set this up and the way that the council has reacted so positively towards some of the initiatives that we've put in place. The problem for me is what happens with the long-term root causes. And so, Sharon's dashboard, I think, will help us get dug into the local root causes. And I just wanted to mention to Sharon and Libby the LG Inform data. That's the report that Megan circulated about homelessness, for example, which kind of brought together a lot of the things that we've heard on the poverty panel, was actually just a push button exercise from local government association. And it's those kind of data which really made me think about how homelessness happens and who's mainly involved. And it struck me that that kind of analysis, that kind of work, it's not something our officers can routinely do. It's a lot of work, and I just wanted to encourage people to, particularly amongst our officers, to consider how we can use that kind of rapid reporting from a central organisation that has all the data and is putting forward a very simple service that we can just press buttons for. It's a very good report on homelessness, and it suddenly brought home to me how serious it is for people who get thrown out of their homes, whether it's through marital conflict or family conflict. Suddenly they find themselves on the street. My own experience is family situations where suddenly there's been changes in eligibility because somebody's pushed over a threshold and suddenly all the grants drop away. These are the kind of things that this 142,000 and backup is all about helping with. Those kind of situations then lead to our officers doing the financial depth analysis, which is so useful. And from then on, we can work into what we can do with our partners in DWP and county and others. So I think we're beginning to get a really good process, but what's missing at the moment, and I'm looking forward to Sharon's results in next year, is how we keep track and how we investigate and how we then can come up with the practical solutions. This is the kind of thing that's been in Libby's head for years and not necessarily transmitted into the councillor thinking, but now it is. It's getting there, and I'm delighted with it. And thank you very much.
Thank you very much, Mike, for that. Yeah, I didn't mention the report that I sent out from the LGA, but as you probably know, all of that information is information that we already have. It's just that they've looked into and tried to analyse it a bit more, haven't they? And it's really frustrating. I can see it from the officers' point of view, especially regarding homelessness. You know, that the officers know what the issues are. We know what the issues are over and over again, I think, and it's just having the resources to be able to look much deeper into it and to try and analyse it more. And I think that's the frustration. That's my perspective. Officers may have a different perspective, but Libby, did you want to just quickly come back on anything that Mike has just said about the long-term root causes and the data and so on?
No, I mean, I just sort of echo. I mean, I haven't had a chance to read that report yet on the homeless, but I think the aims will be similar. It's about overlaying our own data and doing that analysis. I think, you know, we've got a lot of data ourselves that we hold on low-income households that they're all separate data sets. And when we did that work around understanding the impact of poverty because of welfare reform, part of that work was about overlaying that data, but it was a very time-consuming piece of work because our data sets weren't easily reportable and layered, whereas what we're trying to develop is this dashboard that will do that work once, and it doesn't take staff onerous amounts of time because the report will link into all the systems and then overlay that as part of that dashboard. And then we can look at that in conjunction with some of the national data like DWP stats. So hopefully we can understand whether it's our council tax arrears, whether it's people in on housing benefit that are in the private rented sector that are in also arrears with their council tax because actually their LHA rate doesn't cover their rent, and that's putting that squeeze so that we can then sort of hopefully do more directed and targeted interventions. But hopefully we're on that journey now. So I do hope that we can help to use it in a way that this sort of LGA report on homeless is sort of showing at a sort of a national level.
Can I just come back, Sharon?
Yes,
Megan?
yes, yeah.
I think the key point for me was suddenly realising how difficult it is to place single people and single mums in particular with the appropriate emergency housing. And that then flows into what we can make recommendations in terms of our planning policy. And it's getting that connection, which I didn't get before, and now I'm beginning to get. And I'm sure Libby knew it all along, but I didn't. And therefore, when I was making representations in the planning authority area, I didn't connect. And I have now got an understanding that I can then start working towards policies in the planning and building area. And John probably knows this from years back, but we need the councillors to make sure we make the right policies that fit. And that's why the dashboard is going to be so very useful, and why your work, Libby, is so essential. Thank you.
Thanks very much, Mike. Thank you. I've noticed Joe's hand up, or shall I take Maddie first? Joe, did you want to say something quickly about what Mike has just said?
Yes, thank you for your supportive comments, Mike, actually. As Megan said, you know, within housing, we've known for a long time that actually we're reaching an absolute crisis point now. I think that COVID is pushing a lot of people over the edge. If you read the report, you will see that the vast majority of homelessness presentations are either single homeless, and that's very often due to a relationship breakdown, or homeless families that are losing their home due to major rent arrears. Obviously, we are really struggling to find temporary accommodation for these families. We're also struggling to find permanent accommodation for these families because rent is rising exponentially, which pushes other people that would previously have been in the affordability range for private rented out of that. You know, we have a housing waiting list of nearly 4,000. So it is, we're in a bit of a perfect storm, I think, at the moment. We're doing everything that we can to address that. We've brought in a significant amount of additional temporary accommodation. We're trying now to source move-on accommodation. We are looking to change some of our stances around some of our long-term unlettable properties, etc., cross-matching people with that. But we know that, or we fear that this may well be the tip of the iceberg for us. We're just starting to feel the backlash from the end of the moratorium on evictions. So we have, as you know, because Cabinet approved it, we're out seeking some new housing options officers. So far, we have been completely unsuccessful in trying to recruit those posts. So we've got that additional strain of struggling to recruit into the posts that would actually support our work towards reducing homelessness. So it is quite a difficult situation, but the thing that I like about the LGA, as Megan said absolutely correctly, all of this information is information that we have provided to the LGA. The information that is interesting for me is how we look in how we're performing in comparison to our sister local authorities. And it's of no surprise to me that actually they're all struggling with exactly the same issues. So it's quite salient to realise that actually it's a huge problem across the Southwest Peninsula, and Devon is struggling. So it'd be interesting to see what else we can do to support this. As I say, we've got various options that we're now instigating. We're having a massive push on encouraging people that are currently under occupying their homes to downsize, because we don't feel it's appropriate to put families into bed and breakfast accommodation. So we're trying to source as many properties as we can, but it's very much a watching brief. So you will be getting updates at each of the poverty panels going forward. Obviously, it won't be myself; it will be Amy at that point. So yeah, I just wanted to comment that yes, it is a huge issue, but as Megan said, we are very aware of it.
Thanks very much, Jo. Thank you. I realise the time's moving on, so I've got Councillor Chapman. Sorry to keep you waiting, Maddie. And then
that's all right, Megan.
Okay, thank you.
One thing that is worrying me, and we get this every year. I don't know if Libby and Sharon have had any update from Citizens Advice or anything, and that is before Christmas, the loan sharks come out, and they target a lot of areas I know around Exmouth, and a lot of families, which makes January and February equally hard because the parents think, well, we'll take the money out from the loan shark to have a nice Christmas for the kids. And then January and February, when all the bills come in, it gets really, really sticky. I don't know if you've heard of them coming out. I've had a whisper that the loan sharks are going around now, which is a bit distressing. Can we have an update, Chair? Do the girls know anything about it?
Thank you, Maddie. Good point. Sharon or Libby, do either of you want to comment on that?
I can, yes. We've tried to collect data through our financial resilience work that's been going on for the last year about loan sharks and how many people we're seeing, and we have trouble getting that. Now, whether that's because people don't want to tell us, or that the people we're seeing aren't the ones that are taking money from loan sharks. I don't know what the answer to that is at the moment, because people just don't tell us that they're having them. We do ask, we ask sensitively as well, but we have had no incidents of loan sharks that we've been advised of. Obviously, it does happen out there. So if anyone's got any further details about where we can engage with the community or groups other than Citizens Advice as well, that would be good to know, so we can try and target some of that and find out how we can support it through using our discretionary funds, rather than people needing to go to loan sharks.
Thank you, Sharon. I was just going to add into that, just looking at what we were talking about earlier and advertising about the new support fund, whether something could be sent out about loan sharks, possibly before Christmas, if there's time enough to do that, just to remind people not to succumb if they possibly can. It's really difficult because we're not in those families' shoes, so. Yeah. We can say it, but if they just don't have any money, they're going to probably succumb to it, and perhaps for large amounts of money. So I don't know whether. Oh, Libby's got a hand up. Yeah, you might want to say something, Libby. Thank you.
Thank you, Chair. No, I'm happy to take as an action that we can also talk to Team Devon about linking up and raising the awareness of the household support fund, but at the same time, encouraging people not to take out or go to loan sharks. So we could tie those two together, and either we can do it through Team Devon, or if not, we'll do something ourselves. So yes, happy to take that as an action.
Oh, thank you. Is that all right then, Maddie?
That's lovely. Thanks, Megan.
Okay, thanks a lot then. I'm really sorry, everybody. I was hoping we'd be finished by 1 o'clock today. Best laid plans and all that. So thank you ever so much for all the questions, and thank you very much to Libby and Sharon for answering them and all the work that you're doing. Really appreciate that. So if we can just move on quickly now to item 7, the food poverty briefing report from Sue Bewes, Housing Services Manager, which you've already you've had that sent out to you with the papers. So thank you, Sue. I don't know whether Sue's with us, actually.
I am here. Morning.
Are you there?
Sorry. Yeah.
I can't see your name. I can't see your name on my list. But
I'm at Town Hall, so you won't have a
Yes, I've just seen it. Yeah, thank you, Sue. Okay.
Brilliant.
Right
Okay.
then.
So, yes, you've all seen my briefing note that I prepared for Megan and for John. So I'll take you quickly through that. And yeah, so 12 years ago, we recognised as a housing service that it would be beneficial to invest in our communities and to provide the environment for people living in our communities so they can thrive and become more confident social individuals, and also hopefully they would be more likely and able to sustain their tenancies as a result. So alongside this, we decided we would work to ensure that people are able to access amenities and have what they need to achieve this. So looking back, the housing service plan reflected this aim and included an objective to deliver 30 events in partnership with HAF Charity, which was changing lives through food, promoting healthy eating and cooking. We still work with them, incidentally. So we already at that time had strong links with groups locally that could help us achieve those objectives. So then moving forward from that point, the briefing note takes you through a short timeline of how we moved the project forward. So it started around September 2018 when we started to deliver food to tenant families in Axminster who had been identified by housing officers as having a need, and particularly officers within our housing rental team, but other professionals as well in the area who work firsthand in those areas. So Housing's community development workers collected waste food from supermarkets on a Tuesday evening, and they delivered them to homes on Wednesday afternoon. So we quickly realised, though, that we had referrals coming in from across the district and not just in that particular corner of it. And we also had an issue around sometimes the sorts of food that we had at that point that we were being given were not necessarily what our families and individual people were finding useful. So that's where we continued to work with HAF Charity and Nourish to actually provide the food, to cook it where necessary, or to give education around cooking and skills in that direction so that people could make better use of whatever foods were being passed their way. So we then we started to fill referrals by coordinating with existing food providers to make sure that we could reach everybody that was coming forward across the district. Excuse me. So the housing service plan in the following year recognised the need for the project to continue and develop. So at that point, the service plan said that we were to develop the Axminster Fair Share project, working with Tesco in Axminster and Nourish, to collect food from the supermarket, cook and freeze it and distribute it to people with an identified need. So aim to do more for rural areas and link with other work. For example, new applicants for universal credit who had limited income for the first 6 weeks, as we know. So that's how we were moving forward then. From September 2019. Then the following spring, pandemic came upon us, so we had to slightly modify how we were working. So in that year, last year, we began collecting food from Exeter Food Action to supplement what we were getting from the supermarkets. We were also getting some non-perishable food from Riverford and Shillingford organic farms because they had lost their markets during the first lockdown. By October last year, DEFRA funded food deliveries started being collected from Fair Share in Bristol and brought to the hub that we set up in one of our flats in St Paul's, which have been in Honiton, which have been used as a community flat for many years. But of course, with the pandemic, we weren't having running any clubs from there or making it available to tenants, so we were able to use it for that purpose. And the coronavirus grant was funding payment for the transport. Then by October last year, there were so many more people being involved in terms of the distribution and getting food out to people locally that needed it, that we helped them set up a WhatsApp group. And then also last October, the community development team helped Ottery community volunteers and the Wave project in Littleham to set up their community fridges, because obviously we realised the main role throughout that period for community development workers has been to help Home Safeguard keep their service running. So they've been working as call handlers, but we also, so therefore we couldn't get as involved with setting up these various projects and larders as we would previously have been. But that's turned out, I think, to be a good thing, because we've got a good sort of pattern now of how we help, which we're able to provide to people in the community. And sometimes we have also helped with providing a location on a temporary basis while these facilities are set up. So by January this year, we started collecting information on all the food providers in the area to create a database, and there are 26 groups based in our 7 towns. Well, they were at the point of me writing this, which was back in October. April this year, DEFRA funded food deliveries stopped. So by May, we started sharing excess food with a small local Facebook group on Millway Estate in Axminster. So residents could then come to collect food from outside the hall. By August this year, the East Devon Food Partnership deliveries finally started. So this isn't a partnership in the technical term. I understand that they don't have, it's not one of the council's listed partnerships, but it's a name that that group of people chose for themselves, as it reflects what they do. So over 500 kilos of waste food has been brought in from Fair Share in Bristol to Exeter Food Action, and then to St Paul's in Honiton, where 8 local food providers collect their share and distributed it to their networks. So that's how it's worked when the food has come down here. So where we are now is there are the 6 food share groups in East Devon, which are Broadcliss, Littleham Community, Ottery Community Larder, Sid Valley Food Bank, which also gives food to Littleham, and Honiton Food Save and Axminster Food Delivery. As I said, at the time of writing this, I had said that Honiton and Nourish had temporarily suspended work, but they're both back online now with us. So you can ignore that a little bit. The housing strategy for the current year includes a section improving our communities that says we will work in partnership with support agencies and other groups to improve the lives of all residents across the district. And clearly our work with the food share projects is consistent with this, and also with the income management policy, and also with the poverty reduction strategy and the public health strategy. And now obviously we're looking at the very strong links that we have with the carbon work that we're doing across not just the district, is it, everywhere. So it also helps by maximising incomes, as it helps reduce people's food costs, strengthening families and communities, taking away the worry of providing food and the stigma of the food bank. If someone can go to a community larder, that can make it a lot less stressful for them within the household. And we are supporting groups working to reduce poverty by bringing them back together as a hub. So also then I was asked after I'd produced this if I could put a few more facts and figures in. So I can do that. We have the people that supported each week with food from the partnership. We have Broadcliss Food Bank, where there are 80 regulars. Axminster, we have 30. Honiton Food Save, we haven't heard back from them at the moment, but being a town, I like to think there'd be a good few people we're helping support. Little Elm Community Fridge, around 50. Nourish Axminster, 50. Ottery Larder, 60 people. Sidmouth Food Bank, 50. Axminster Churches Together, 2 people regularly, but at Christmas there'll be a further 50 because we've got an arrangement with them for Christmas. So I'd say that's over 300, but probably nearer 400. It depends what numbers come back from Honiton. Currently, 550 kilos of food is brought by the partners or bought by the partners, but every week the food is topped up in Bristol with extras. If there are any extras, they just get them as freebies, such as pots of soup, fresh fruit and veg, and there's also other additions by Exeter Food Action. So partners can end up taking back twice as much as they actually paid for. So this happened with Honiton Food Save in September, apparently. So this year, the tenants on our delivery list, this is the Christmas arrangement we have is, so our regular delivery list, they will be getting a frozen Christmas dinner from Nourish, a community organisation that we mentioned earlier, delivered on Christmas Eve, and a food hamper from Axminster Churches Together. So we've supported Axminster Churches Together with small donations of food throughout the year as a swap for them doing this for us for Christmas. Because both our community development workers would like to take some well-earned annual leave over Christmas. So it's all worked out okay. Our tenants will get their usual size delivery and a little something extra to help them through. So the food collection from supermarkets that we won't be making on Tuesday, 28th of December, has been offered to another food provider, Ottery Larder, which we helped set up, for them to accept and take the food to give to their customers. So that won't be wasted. The briefing note then went on to talk a bit about our long-term view. So as I stated then, we aim to pass the supermarket collections over to someone local. The community development workers are seeking funding to support the food partnership for its first year. We also need to map the food support in rural parishes and either link them to the nearest food bank or support them to set up their own community larder. We don't currently know Devon County's plans. I know that they're keen, we do want to step into line with them if we can, but equally I guess we've learnt quite a lot from how we've developed over the last couple of years, and we know that it's been developed in accordance with the needs that we knew was there, because it was presenting, people were presenting through our officers, but equally it has grown in size, this need. So we don't want to get so far removed from that by trying to do a county-wide effort that we're no longer quite supporting the need that we know we have locally. So whatever we do with them, we just need it to be flexible enough to make sure that we're still hitting the spot. I should probably also mention that our Climate Action Officer, Catherine Causley, has got some funding together to make a short film about the food partnership. The funding is from COP26, so it will be from a food waste point of view. And I do have access to that little video, which is only sort of 3 minutes, roughly, if you would like to see it.
Well, I'm just wondering whether we have time for that, actually, Sue, because we're running over and we've got another item, quite a lengthy item to discuss. So
all I can say then, I believe it is going live today on YouTube, but if there's any problem with that, and if that's not happening and people can't access it, I could send you the email and access that I was given, but I'd want to do that individually if for some reason it hasn't gone out on YouTube today.
Well, what does everybody think? I mean, I'm just concerned about the time now, and I don't want to have another 2 o'clock end meeting, really, and I'm sure nobody else does either. So if that could be sent out to us, for people who request it. Is that the way we should go, do you think, Sue? Is that all right?
Yeah, I'm fine with that.
I'm really sorry that we are up against it a bit at the minute, but
yeah,
thank
no
you
worries
very much.
at all.
Is there anything else you wanted to say, or shall we move into questions?
Yeah, nothing else from me, thank you.
Thank you ever so much for doing that report, Sue, which I know you've had to sort of fit in amongst everything else that you do. I think you were off last week, weren't you? But I emailed you about the update on the list of the food providers, the 26 food providers, which was done. It's in an action in the report, January 21, and saying that it was being updated. Do you know whether that has been updated yet or not? And can we have that list, please?
I will find that out and make sure that you get that as well. The updated list.
Lovely, thanks. Okay then. So we'll move on to questions from outside. We've got Councillor Miller.
Yeah, I was just to say in the verbal report given, there was a reference to a written report, which I can't see that on the agenda, and it would have been really helpful to have, if there was a written report, because there's a huge amount of information there, and I wasn't really able to take many notes at all, and that's no disrespect to the officer that's obviously worked hard on the report. I can't see any, and I can't ask a question.
It was sent out. It was sent out.
It's not linked on the agenda. So
I found it last night, Paul. Sorry about that. It is on there. I suppose it depends which agenda you go on.
I've got on both. I mean, I think it's not there, so it hasn't been sent out to all council members. So I can't read it, and I don't think the public can read it. So if they were watching, it's not linked on the public website, and I've gone onto the private extranet web, and it's not linked there either. So if it was sent out, I don't think I got it.
It was a link. It was on the agenda because I went on the public site last night and I clicked on the item, on item 7, because it's underlined, and then it comes up.
Well, it must be a technical problem my end then, because I can't pick any of it.
But we can send it out to you separately.
Thanks. Cheers.
Sorry about that.
Megan, I'm sorry that it's exactly the same. It's not on my agenda. So I think there's something happened to the website agenda.
Oh, well, it's strange that I could find it, but thank you. Well, do you want me to send it out to you as well then, Mike?
No, it's not necessary because I picked it up yesterday. What I'm saying is it's
not on there.
Suddenly it changed. So I don't know why.
Yeah, we'll check that out after the meeting. Thanks for raising it anyway, both of you. So does anybody, I haven't got any more hands up to ask any questions of Sue. But one thing that struck me when I was going through it, I just wonder about whether, as has been mentioned before in the meeting, and we keep mentioning it over and over again, about getting to the root causes. And I just wonder whether, we have to be careful that we're not just looking at the actual symptoms of people being hungry. And I know there's some really good work being done by the team and following all of this up. But I'm just wondering whether, following the Simon Kitchen report that we had at the last poverty panel from the County Council, whether I think that Libby and Sharon sit on the Food Network. Am I right in thinking that, Libby? And whether this could be followed up as a forward plan and trying to link in with what Simon Kitchen was talking about. And you're right, Sue, that I don't think they've got any definite plans with that as yet, but Libby might be able to update us on that. And ask Libby and Sharon to build on the work that's already been done by Victoria and her group, find out what any gaps are and how to link that in with the County Council. I don't think Libby hasn't got a hand up, but I'm just wondering whether you've got any comments on that, whether that's a way forward, Libby.
I'm happy to be involved. I have been on a couple of meetings, but I think I was covering for John Golding. on them. So I think John's the key contact, but I'm happy to, to pick up that work. Obviously, with the work we're doing around the Household Support Fund and the wider work that we're doing at looking at root causes of poverty, that work sits as part of that, which we're doing with county anyhow. So food is sort of, a massive part of, people being in crisis and obviously a symptom of that. So yeah, more than happy to, but I don't equally want to tread on anyone's toes.
No.
I don't know if John's still here, whether he's got any comments.
John is still here. He probably wishes he wasn't here, but
Yeah.
Johnny,
I'm still here.
maybe want to comment. Sorry, I'm putting words in your mouth.
What I wouldn't want to detract from is the remarkable work that's being undertaken by the team, except it's not a long-term sustainable thing to have food banks on this scale. But in the absence of people having sufficient money to be able to feed themselves well, I was just hugely impressed and proud with what the team are achieving. I've not attended any of the county meetings. I think they've been cancelled recently. But whilst county and others are talking about it, we're actually doing something quite remarkable and quite large scale. So I'm hugely proud of what the team are doing whilst it's needed. And just in terms of the agenda, I've accessed the reports from a separate email that went to all councillors on the 12th of November that Sarah sent out for us. So this report, the homelessness report that was referred to earlier, and the poverty action plan strategy was sent out to all members. It might not have been linked with the agenda, which might have confused a few people. Thanks, Chair.
Thank you. Thank you. Okay. Yeah, I think all that I was concerned about. Yes, there's a lot of good work been done on the food poverty side of things, but it's whether it's long term. That's the thing, and I think we have to be careful that we don't have people relying on that. And it's not consistent. It's not. People don't rely on it so that it's not sustainable, basically, because that's not a good way of moving forward with people. And I think, as was mentioned with the report that we had from, I think it was Sharon at the last meeting, there was a case study where people were relying on food banks and so on. And once the finance team got into the detail of it, they managed to get that person and that family more money per week. So therefore, they didn't have to rely on food banks anymore. And I think that's the way we should be looking at it. That's my personal view. I'd like to think that we can move forward with Devon County and bring it all in together and get a proper sort of sustainable policy moving forward. That's what I'd like to see. So I'll leave it at that for now, but thank you for your comments. And yes, thank you, Sue, very much for presenting that to us. I'm sorry we're having to move on pretty quickly now, but thanks a lot. Okay.
No worries, thanks. I've just sent it across to Sarah, the link, right, so everybody can watch that after if she can get it out.
Yeah, that'd be great. Thank you very much. Lovely.
Thank you.
All right. So if we move on now, and I realise the time it's nearly 1:25. At this point, we were going to look at the Poverty Strategy Action Plan updates. This might be quite quick, I don't know, but we've got officers here who can go through those details. And Sarah, can you just remind me, was this updated plan as we had it at the time the agenda went out? That was sent out, wasn't it?
Yes, it was. It's the same email that John Golding's just referred to.
Yeah,
it was sent as an email attachment. It wasn't put into the actual agenda papers.
Yeah. So you've got most of the updates there in front of you, and I think what I'd like to do is just quickly whip through the 5 areas and see if there's anything extra that officers wish to add. to that. Is that all right with everybody? And we'll try and keep it brief. And I think this should be a regular item on the agenda, and perhaps bring it higher up the agenda so that we can spend a little bit more time on each of the areas. So, Libby, if we can start with you, please, on your finance. Have you got anything extra to add? Because you did do your update, and I think that update was included, wasn't it, Sarah? It came in time before the agenda was sent out.
Yes, it was, Chair.
Yeah. So I just wonder if anybody has any questions they wanted to ask of Libby. I think everybody's had enough probably, and they just want to go. But I can't see any hands up, Libby. Is there anything else you wanted to add to what you've already written?
No. We've provided an update. We're happy to present or keen to present the poverty dashboard. It will be work in progress, maybe either at the January or March poverty panel meeting, depending on what other issues that you may want. But we're happy to do that, and it will be something that will continually evolve. So it's not it won't be a finished product at all, but it would give a feel for where we're at. And we've updated, there's been a number of actions like the corporate debt policy that's been updated to reflect the work we're doing, discretionary housing payment policy, they've all gone through cabinet recently, CTR reports going through on December, and a lot of our actions are around the dashboard, getting data to measure some of the outcomes that are being achieved, and around the work of the financial resilience officers. So we've done an awful lot, but clearly a lot of it will now be about getting those measures to help inform future policy and strategy of the work of this group, so that they can then help to inform some of those actions.
Lovely.
For me, but I'm happy to answer any questions.
Okay, thank you, Libby. I can't see any hands, so we'll move on. Thank you to Jamie. Do you have any updates on any of the community engagement type work?
No updates other than what's already been said, either as part of the working together event item or slightly after that. Happy to answer any questions though.
Okay. No, I don't think anybody's got any hands up. Thank you then, Jamie, that's fine. Andy or Sally, if you're still with us.
Still here, Chair. Yes, thank you. Well, it's only to add that I think Sally gave a very fulsome update on the current employment and skills position in the district to the last meeting. She's also coordinated the update of the action plan as well. I'm very happy to take any questions. It's mostly a work in progress, if that makes sense.
Yeah, that's fine. And thank you for sending that through. You were the first ones to send something through, I think. No, I don't think anybody has any questions on that. So thank you. We can always bring them up at the next meeting if people have, once people have read it and want to bring anything up then. Joe, from housing, I think yours is just a verbal report, isn't it? And anyway,
apologies for missing the deadline for getting it out before the papers were done. I have actually done the update this morning, so I will send that over to Sarah after the meeting.
Oh, thank you.
Yeah, the biggest update for us really is regarding to the reduction of heating costs, etc., for our tenants. We have now completed 120 homes have now been upgraded to as clear as we can get, or as near as we can get to carbon neutral. So that's good. We've had really good outcomes for that. We've also just submitted a bid for the new social housing decarbonisation fund. So that will lead to a programme of £1.2 million. The thing that we learnt from doing the last round of these upgrades was that you need to focus on the fabric of the building before you do anything else. So this whole bid in this next round is built around what we call the fabric first approach. So we will be upgrading the insulation, windows, all of that sort of stuff on all the housing stock before we go to putting in any green home technologies. So of course that will mean that any home affected, it will make their current heating system that much more effective as well. So we'll hopefully reduce their sort of fuel poverty loading whilst we're putting in the green homes technology. So I think that's the way we need to do it going forward. Obviously, an impact on that will also be the stock condition survey. So that will alert us to the housing stock that we have that is of the lowest EPC value. So anything that has a low EPC value means that actually it's very, very energy inefficient. So therefore is likely to be causing our tenants to have a much higher fuel cost than anywhere else. So those will be focused on any future bidding rounds that we make. Obviously, we are already doing that. We're now currently bidding for anything that is over or under a G. So those are predominantly homes that are still heated by solid fuel. So those are the ones that we're predominantly doing. So that will be really great. We should hear just before Christmas whether we've been successful for this bidding round. We're bidding for, or we've asked for, an award of 500,000, just short of that. And then we will be match funding with 880,000 of our own funding. So, so fingers crossed we'll do well with that. The other thing that we have quite an update for is point 2.3, which is around the provision of community days in our low income areas. And that was specifically around providing disposal mechanisms for bulky waste that our tenants may have. We've gone a little bit further than that. We had a meeting with Ian Williams around the social value element of that contract. So we've had some consultation with tenants and things about what they would like that social value to look like. And on top of things such as skips and whatever, we've also had requests for the provision of community gardens so that people can grow their own food. We've already got an orchard that's up and running. So we now have from Ian Williams a full new programme of social value. I felt it was very important that social value should offer something tangible to our communities and not just be something like, oh, we've got a couple of apprenticeships. So what we've organised so far are the skip days, the community garden builds, training sessions for tenants around minor DIY, minor decorating, that sort of stuff. We've also had some preliminary discussions with Catherine Causey. She is very interested in coming to do community centre sessions around how to either swap people to more affordable, greener energy tariffs, and also to perhaps discuss strategies for reducing their the cost of their fuel. So I think all of those things will help with that, community support that is so desperately required. So, and then I think the other thing that we're acutely aware of is point 1.13, which is around the discretionary payments. And I think it ties into the conversation that we were having earlier around the lack of affordability now for a lot of people moving into the private rented sector. And because of the stock issues that we have, we just simply do not have the social housing stock to be able to just put people in there when we would probably desperately wish we could. So the fact that private rented rent levels are reaching an unaffordable position for a lot of people is a huge worry for us. So I think there would probably be quite a lot of work going on between our teams and Libby's teams to see if there's anything further that we could do to support that. Obviously we have the rent guarantee schemes, etc., but that doesn't, although that helps with getting people into the accommodation, it doesn't help with sustaining it if the rent levels are too high. So so those were the major updates from housing, Megan, but I've done that into the plan now and we'll send it to Sarah after the meeting.
Well, thanks ever so much. That's great. Thank you. Thanks a lot. I don't think we've got any questions, have we? No. So finally, Helen, if you could just, anything to add? I think you may have had something from private sector housing, didn't you, to,
yes, so just
add on
quickly
to
to explain, I liaised with all of the team leads in environmental health to pull their feedback together for the original report that was circulated a few days ago by Sarah. Subsequently to that, I did have some information from private sector housing submitted. So do you want me to go through each of Jodie's items, or do you want me to just pick out a couple? And I've sent
just pick out a couple, yeah, for the time. Yeah, thank you, Helen. Yeah.
So picking up on Joe's comment about 1.3, Jodie has added that private sector housing work with Exeter Eco, that's the energy charity company, and retrofit companies to deliver eco top-up, and an organisation called Lendology, which Jodie talked to us about when he presented to the poverty panel, to arrange loans for home improvements that works with poverty and also with the climate change. And then I think 4.5, for instance, he'd picked out something. There's a lot of pages to scroll through. Yes, so 4.5 is about supporting private tenants in their homes, and he's commented that this is ongoing work. Winter Resilience Project is a holistic and collaborative approach utilising financial resilience, project grant funding, and formal assessment enforcement processes. So there's various more items from Jodie which Sarah will be able to incorporate into the next iteration of the monitoring plan. Thank you.
Thank you very much, and thank you to you all for updating. I know it's a bit of a job updating everything, isn't it? But you know, if we do it a bit at a time at each meeting, hopefully it won't be too onerous on everybody. And I'll talk to John and Sarah and one or two other officers about how we can handle that in future to make it a little less onerous for you. So thank you ever so much. I'm sorry it's gone on a long time. These meetings are always really popular and people always want to ask a lot of questions. So that's looking at the upside, isn't it? But unfortunately, it just goes on a bit too long sometimes. So we're actually on the last agenda item, which is the date of the next meeting. So at the last meeting, it was agreed the panel continues to meet every 2 months during 2022 to receive any updates from officers and external organisations and to monitor progress of the Poverty Strategy Action Plan. The following dates up to May next year have been agreed as 31st of January, 21st of March and 23rd of May. Further dates for the rest of 2022 will be arranged following the annual council meeting. And also, please note, I think everybody was agreeable to starting at the panel meetings at 10 a.m. so that if they do run over, which I'll desperately try for them not to in future, at least it's not going straight into lunchtime. So I hope that's all right with everybody. So that brings our meeting to a close. I'd like to thank everyone for participating, including any members of the public watching online. Can I remind all those present, the supporting officer will confirm when the meeting is no longer being recorded or going live. And until then, your comments will be live to the public. Thank you very much, everybody, and for all your inputs and all your questions. It's much appreciated. And if it's not too soon,